Welcome to my channel RX Sam 2020. Today we discuss a drug name, Xylometazoline. About Xylometazoline is a decongestant and an antihistamine drug. It works by easing the inflammation and blocking nasal passages by narrowing the blood vessels, vasoconstriction, and reducing the swelling. Medical use. This medication is used for temporary relief of congestion in the nose caused by various conditions including the common cold, sinusitis, hay fever, and allergies. Use is not recommended for more than 7 days. Use is also not recommended in those less than 3 months of age and some say not less than 6 years of age. It is used directly in the nose as a spray or drops. Use is not recommended during pregnancy. Contra-indications. Undergo transsphenoidal hypophyseectomy or surgery exposing dura mater, narrow-angle glaucoma, and atrophic rhinitis. Children less than 6 years and pregnancy. Special precautions. Patient with cardiovascular disease, hypertension, diabetes mellitus, hyperthyroidism, prostatic hyperplasia or urinary obstruction. Elderly, children greater than 6 years, and lactation. Drug interactions. Xylometazoline may interact with antidepressants, amitriptyline, isocarboxide, phenelzine, selegiline, tranylcypromine, moclobemide, antibiotics, linezolid, drugs to treat Parkinson's disease, rasagiline, safinamide, blood pressure medicines, guanethidine. Side effects. Side effects include trouble sleeping, irritation of the nose, nausea, nosebleed 3%, period pain 10%, and headache 3%. Brand names that are mostly prescribed by doctors: Balminil, Otrivin, 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 Otrix, Xylomet, Xylostar. Dosage. Nasal. For nasal congestion. Adult, as 0.1% drops. Apply 2 to 3 drops 2 times a day to 3 times a day into each nostril. As 0.1% metered dose spray, 1 spray in each nostril 1 to 3 times daily. As 0.1% spray, 1 spray 2 times a day to 3 times a day into each nostril. Maximum duration 7 days. Child less than 6 years as 0.05% drops, contraindicated. 6 to 12 years as 0.05% drops spray, 1 to 2 drops spray into each nostril 1 or 2 times daily. Maximum duration 3 days. Advice. Xylometazoline works right away and each dose provides relief for up to 10 to 12 hours. The right way to use the nasal spray. Shake the bottle before using the medicine. Clean your nose thoroughly before using the medicine. Insert the bottle tip into one nostril and close the other nostril. Direct the spray towards the sides of your nostril, away from the cartilage dividing the two sides of your nose. Breathe out gently through your mouth and repeat the same process for the other nostril. Xylometazoline can make nasal congestion worse if used for more than 7 days in a row, called rebound congestion. Avoid deep breathing as it will cause the medication to go back to the throat and make it less effective. Do not share the bottle with anyone else so that you do not spread germs. What foods should be avoided while taking this medicine? Avoid cold foods and drinks to ease your nasal congestion. Action. Description: Xylometazoline is a direct-acting sympathomimetic agent that produces vasoconstriction in the nasal mucosa, thereby decreasing nasal blood flow and congestion. Onset: within 5 to 10 minutes. Duration: 10 hours. Thank you for watching. Please like and subscribe to my channel and click the bell icon to get video updates.